To be diagnosed with a hole in heart could mean a death sentence for many in Ghana because of the cost implications. On the average, heart surgery in Ghana costs between $6,000 and $13,000. With the cost of heart surgery out of the reach of most Ghanaians, many patients are left to wait for the benevolence of individuals and organizations, and in some cases die before care arrives. But as Elton Broby reports, a Chinese investor has stepped in to pay for the cost of treatment, at least for the next 10 years.
Statistically, one child out of 100 births has a heart or chest condition. Smoking, excessive drinking, long exposure to X-ray, and poor eating habits by pregnant women are some of the causes of heart and chest conditions in children. The taking of drugs without prescription and the failure of some expectant mothers to attend antenatal care are the other causes. For most patients suffering the disease, cost is a huge barrier. Here is consultant at the National Cardiothoracic Center, Dr. Koe Mensah.
One of the pains that we have had is to see a child with a hole in heart condition who can be saved through relatively simple surgery. And there are no resources to be able to do that. It's very painful. Sometimes when you mention the amount, the parents break out in tears, because some of them cannot actually imagine what the equivalent of $6,000 look like, because they work with such a very small capital. And to have the opportunity to be able to do free surgeries for 25 children every year, that's about a third of our capacity now. It's extremely significant.
But there is hope now, at least for the next 10 years, because patients without means to undergo surgery can apply for support from the Shen Yuan and Shen Yuan Foundation. Named after 17-year-old Shen Yuan, himself a hole in heart survivor, is a son of Chinese investor Shen Shan, who is a founder and chairman of the Sunda and Keda groups of companies with operations in Ghana in the last 20 years. Realizing the difficulties his son went through and the impact it had on his family after being diagnosed with a hole in heart at age 5, he gladly accepted a call when businessman Herbert Mensah suggested to him the idea of lending a hand to help patients in need at the Cardiothoracic Center.
Playing some of my part from my heart. You know, when my elder son was born in 2005, after he was born 4 or 5 months, we got from the doctor, he has the heart disease. That time, the period, we feel very painful. And we go to a very good hospital in China, and he do the operation. He gets saved. But after he gets saved, in the next 4 or 5 years, he always sick, because the body is not so strong.